Hello, this is Naudi Aguilar at Functional Patterns. For today's video, I'm going to show you some techniques to help improve the function of your breathing. Breathing is one of those things not addressed too commonly in the fitness industry, even though it is functionally one of the things that we do most in life. Maybe the thing that we do most in life. When you're asleep, when you're exercising really hard, you do it all the time. In terms of importance, just think about how long you can live without food, which is an essential element for us to survive. That's usually going to be about a month, anywhere between 3 to 4 weeks that you'll live without food. If you think about how long you can live without water, it's anywhere between 4 to 7 days that you'll live without water. How long can you live without oxygen? Well, it's probably going to be anywhere between 3 to 7 minutes. So you're not going to live very long if you're not breathing. And essentially, breathing is one of those things you should probably be really good at. So in this video, what I'm going to show you are some techniques to help improve the function of your breathing. This is also going to essentially help you improve your posture as well. Your diaphragm, what helps you control your breathing, is actually going to be one of the fundamental building blocks towards developing good thoracic extension, because the diaphragm actually attaches right there on the T-spine. So if you were to take a deep breath, really deep as far as you can, and pull your navel in, you might begin to notice that your T-spine will begin to bend backward a little bit. Or maybe it doesn't. And that can be because of certain restrictions that are present on your body. And that's specifically what we're going to address in this video. I'm going to show you some myofascial release techniques to help you intrinsically change the biomechanics of your breathing. So let's get these bad boys started. For the two techniques I'm going to cover in this video, you're going to need a very soft medicine ball. We're going to be utilizing this to get into our intercostal muscles on our rib cage, so it's going to be required to be soft. And we're also going to need kind of a squishy ball. You can use a tennis ball, but this is like one of those little league baseballs. It's really, really soft, has a lot of give to it. We're going to use that to release our serratus posterior inferior. So to start, we're going to be going into the intercostal muscles. The intercostal muscles are really going to be the muscles in and around your rib cage. These muscles, once you develop like an anterior pelvic shift, I always tend to talk about, because you're in hyperextension because you have a hip flexor restriction, typically the shifting of the pelvis will also lead of a posterior shifting of the rib cage, where your rib cage will shift backwards and you'll begin to create this kyphosis in your upper body. What then that does, it has all your tissues, an area called the superficial front line, that begins to pull you downward. And with that tightening of this superficial front line, there's going to be lots of restrictions happening directly on your intercostal muscles. Since you are stuck in this direction, you're typically not going to breathe in very well while you're here in thoracic flexion. So it's going to be essential for us to at least get into these intercostals to allow for more rib expansion and to get those ribs nice and open again so you can take a deep inhalation. So the way we're going to set ourselves up for this technique, we're going to be lying down, and very simply we're going to go on this soft ball here. You're going to extend out one arm, and you're just going to kind of let the weight of your body drop into this medicine ball. A lot of times what I like to do is just kind of find one spot where it's most tender, hang out there, let the ball kind of do its work. Be careful not to use a hard ball here. We don't want any kind of bone-on-bone contact between hard surfaces. You're not going to get a benefit out of that. Muscles or bones don't release. Muscles do release. Tissues will release if you keep pressure on them long enough. But bones definitely won't. So make sure you don't use any kind of a lacrosse ball to press in here. I don't think you would be able to bear it anyway, but you can kind of just move around in here. You'll also be getting into some of the muscles of the serratus anterior around these regions. Maybe even some of the obliques if you get down low enough. But essentially you're just going to locate all these areas right here on the rib cage, and you're going to essentially try and target them all the way almost clear to the sternum. And so you can just move around these different surfaces. One thing I really like to do along with this is take some deep breaths, almost like a version of active release. I'm taking the ribs through a range of motion as I'm breathing in and applying pressure. The key point is, make it uncomfortable. Not uncomfortable to the point where it's some kind of a sharp shooting pain, but just uncomfortable to where you can feel like muscles are kind of aching, almost like a toothache to one degree or the other. So at that point, you'll just kind of hang out here on these areas. I'd recommend anywhere between, I guess, 2 and 10 minutes, depending on where you're at. If you're a person who already does maybe like yoga or something like that, your ribs might be open, or they may not be. Maybe you've been breathing in, but you've been compensating in a certain way. Play it to whatever your experience with. If you have a lot of experience with myofascial release, you can go up to anywhere between 5 and 10 minutes. If you don't have much experience, maybe you may only want to do this for about a minute. Next technique we're going to focus on is going to be on an area called the serratus posterior inferior. It's going to be located around what we would call the thoracolumbar region. So at this point, we're looking at the thoracic spine and the lumbar vertebrae. So we're going to be looking around these areas here, right where that T-spine is. Well, we got to think that whenever you begin to, when you begin to round forward in this kyphosis in this manner, You can also begin to assume that when you get that flexion coming forward, you're also going to get an elevation of the scapula. The ribs are going to slightly elevate, the scapula is kind of elevate, but also there's going to be a significant amount of restriction right at this point here, especially because people who have kyphosis also tend to have some kind of a hyperextension in their lumbar, or their erector spinae will get really tight. So in combination of having the kyphosis here, the scapula elevating, and then the hyperextension, those serratus posterior inferior muscles take a beating. And so us getting in there is going to enable us to get a little bit more out of the lumbar hyperextension, but further than that, allow us to actually elevate the ribs more vertically, because these will not be pulling it downward. I release that, and that should enable my ribs to go upward and outward in that fashion. So the way we're going to set it up, real basic, we're going to lay on our back, place the ball not on the spine, we're going to go just slightly off of the spine, right to that spot, just about, I would say, maybe about 3 inches below your scapula, maybe 2-3 inches, depending on your height, obviously. So for me, I'm probably going about 2 inches below my scapula, and I'm just going to hang out here and keep that pressure right in that area. And what you're looking for is these ridges that go back and forth, these lumps going back and forth, and you want to get at the center of where those lumps are. Once you find one of those good lumps, what I'll end up usually doing is just taking a nice deep breath. With that rib elevation, it's going to then begin to pull those serratus posterior inferior muscles apart as I'm releasing them with the ball. Feels really good. Keep in mind, you may have one side that's worse than the other. I'm a righty, my left side tends to be worse, and I found that to be very common. That may not be the case directly with you. Just something to look out for. So you'll kind of just get in here, releasing those suckers. You can switch sides and do the other side the same way. Again, do it to what your body intuitively feels like it needs. Some people tend to be really restricted, and if you put a lacrosse ball on them or something along those lines, their body could have an adverse reaction if you have them go for longer. I always tell people, take it slow beforehand if you're not experienced with myofascial release. If you're a myofascial releaser and you've been gung-ho about it like I am, you may be able to hang out for a little while longer. But one thing you probably will notice, and one thing you may want to do right now, if you've been practicing this along with me, or if you've paused it and you decided to practice these techniques, is that if you take a deep breath, you should notice a much higher capability of opening up your rib cage than what you had before, because we released the restrictions inhibiting you from actually being able to breathe better. Just think if your intercostals are tight and they're pulling you and holding your rib cage together on the exhalation. If you think that your serratus posterior inferior is holding your ribs in some kind of a depression, then at that point, when you can't elevate and expand the ribs, you will not get that deeper inhale. For those of you trying to improve your cardiovascular function, or if you're trying to better your posture, it all really starts with breathing well. And even for people that are so obsessed with core training and being able to recruit their transverse abdominis, if you cannot breathe well, I assure you, you probably will not be able to activate your core. That gets pretty complicated. I won't go into that in this video, but if you look forward to the next videos on this YouTube channel, I assure you, you will find more information like this on that. So if you did enjoy this video, please click like on it, share it to your friends. This is Naudi Aguilar at Functional Patterns, reminding you to stretch intentionally and not habitually. Take care.